This is my alma mater, and my journey started here. And I'm going to be talking about that journey, which has changed my life, and that it has resulted in redefining the healthcare in Pakistan. So I'm a graduate of 1987. Certainly none of you were born at that stage, and probably some of your parents also weren't born at that stage. Anyway, back in 1987, there was a huge big bomb blast in Sadr. That was the time where Russia had invaded Afghanistan and terrorism had started to spread over Pakistan. And a very large number of dead bodies and injured people came to the accident and emergency department of here, civil hospital itself, which at that time was only 2 rooms, even smaller than this. So obviously the place was inundated and there was a lot of mayhem. At that stage, I belonged to the association you are very well aware of, Patients Welfare Association, and some of us worked together. We got together and we actually built the accident and emergency department of this civil hospital. It probably doesn't exist anymore since the trauma center has come in, but it did last for a good 20 to 30 years and was the accident emergency here. But what it also did was to bring together a group of people who were doctors, engineers, and architects. So we at that stage decided that when given a chance one day in life, we will build a hospital which will provide best quality of care and be absolutely free of cost to anybody who comes over there. And that is what this journey is about. But there are lessons in this journey as well, and I'd like to share them with you. So those who are crazy enough to think that they can change the world are the ones who actually do it. I went away to UK, as you heard, and I trained and became a pediatric urologist. My other colleagues did various things. I came back, many of us joined again, and about 16 years later, we rejoined and we started the Indus Hospital project in 2005. And while this is a building in Kurangi, which we inherited, it was the Islamic Mission Hospital in a pretty pathetic state. But while we were thinking on what to do with it, fate has it, there was the October earthquake that happened. And a very large number of people were killed and displaced. But what it showed is that when there is a crisis, people in Pakistan get together, and the belief in Allah was so strong that we realized that yes, we will be able to build this hospital. And slowly and gradually we managed to do that. And back in 2007, we opened the doors to the Indus Hospital. It was a 150-bedded hospital built about $10 million at that stage. And all the funds that we raised were actually collected here in Karachi from school children. I used to go to various schools and collect coins and everything. And that's what we did, and we did that. So when you are faced with a situation, life is not about waiting for the storm to pass. It's about learning how to dance in the rain. And that is one of my messages that I'd like you all to take today. So while we were building the hospital, it was very clear to us that we need to think of the future. And back in 2007, the hospital started as the first paperless hospital of Pakistan. Not just Pakistan, but in the region as well. And since then, all the work that we do, everywhere that we do, is all paperless and digital. This was our OPD when we started, and you can see a young me back in there performing the first surgery in 2007. And within the next 2 years, the College of Physicians and Surgeons recognized us for some of the trainings that we were doing. And within 2 years, we had done 10,000 surgeries in the hospital. We got accredited, and not only that, the project itself became so absorbing and so functional that Harvard School of Public Health actually came, wrote a case, and was teaching that in their courses over there. And hence, Indus Hospital that we see today was born and was functional in Kurangi area that we have. But we all felt there was more energy. There was certainly more that we could do with whatever we were given with. And there was an opportunity to do more. And the idea came about that you need to work with the public sector. Without the involvement of the public sector, you can't really change the way the paradigm of the health works in Pakistan. And as a result, when this idea started to come, other forces started to join us. And when you desire to do something, all the universe tends to be, helping you in achieving in that. What happened? The Punjab government, in that time, in Punjab there was floods, and the government of Turkey had built a hospital in Muzaffargarh. It's a small town, 40 kilometers from Multan, and the Punjab government gave this hospital to Indus Hospital to run it. And we realized that geography was no more any challenge to us, and the challenge wasn't outside, it was more within, and we need to overcome that, and that is the message that we learned. Another hospital we took over near Sadqabad. This was in Bhong. It's a small place, very agriculture place, and we started running that hospital again. What happened after that? Our board in the hospital decided that we have the energy, we have the motivation to actually build a network across Pakistan. We decided that one day, as time passes, we will build a large tertiary care hospital in every province of the country and link it to smaller hospitals and have a network over there. And that was certainly a dream, which was not simple. But there was opportunity yet again. In Lahore, they were building the ring road, which was surrounding the city. And those who have been there, you know that the larger hospitals, the teaching hospitals in Lahore, are actually all based in the center of it. And people have to travel from all parts of Punjab to it. So we offered that if 5 hospitals could be built around in the ring road region as secondary hospitals, they'll take away the load of the teaching hospitals in the center. And that is what we managed to do, that during this period, we managed to build 5 hospitals in Lahore, build them with the government, with government's funds, and ran them for them so that secondary care could be provided. The first one was the Mother and Child Hospital at Bedia. Then came the hospital in Manawa. Then it was followed by a hospital in Sabzazar. These are all along the ring road in Lahore. Then in Raiwind. And finally, the last of the 5th was the Tananu Hospital in Lahore itself. When you start doing things, people start looking up to you and expecting you to do more. So tertiary care hospitals in the south of Punjab were offered to us, and we now run the main institute, the Multan Institute of Kidney Diseases as well. So the hospital in Muzaffargarh, that was increased in size to 400 beds with over 21 specialties. And as you can see, it is a hospital surrounded by nothing, just sand. And still, it is a beacon of light for people in that region. When good people start to do good work, there's always collaboration. There was a children's cancer hospital present in Federal Bay Area, a small hospital, which we decided since our mission was same, we joined together, and hence was formed the largest children's cancer unit in Pakistan, which is now at Indus Hospital. Similarly, the International Red Cross decided that they're going to help Indus Hospital build rehabilitation centers. So we built one in Karachi, one in Lahore, one in Badin, and one in Muzaffargarh. Blood, and where we had all come from, Patients Welfare Association, our first teaching was blood center and blood banking. So we realized that in Pakistan, healthy blood is a problem, and centralized blood banking would be a great help. And what happened was, with the help of the German Development Fund and Punjab Government's Association, we took over blood centers, and this is a blood bank of Nishtar Hospital before. This is what it was after we took over. And to date, we have 4 regional blood centers running across Pakistan, in Karachi, in Bahawalpur, in Jamshoro, and in Multan region as well. And these are providing free of cost blood, clean, healthy, certified blood to hospitals, government hospitals in that region, so that all the diseases that are transmitted from blood could be saved. As our focus then changed towards looking at Sindh and at Balochistan. And both areas required help as well. So we were offered the hospital in Badin, the civil hospital Badin, to run it for them. And similarly, a children's pediatric cancer unit was built in Sheikh Zayed Hospital in Quetta. Finally, the Park China Hospital in Gwadar, that was also taken over by Indus Hospital, and we are running it as well. Recently, a very difficult area, trust me, we have been running a hospital in Dera Bukti and again in Sui as well. So what has happened over the period of time? We were in Karachi, then we started to spread our wings across in Sindh, in Punjab, and in Balochistan, and we are hoping to now move into KPK as well. And the network has gone right across Pakistan. The advantage of having a private-public partnership together is that the public sector brings in the funds, they have the controls, and the private sector is providing all sorts of systems in which improve both in supply chain, in human resource, data keeping, and the winner in all of this are the patients itself. However, when you look at the health of the nation, you realize that there is a lot of work and often spending done in the tertiary care. Secondary care comes next, and the primary care in the country seems to be very much unattended. And that's where the problem is, because that's the larger part of the population that is living in there. So Indus decided that we're going to develop ourselves in the community health as well, so that we can have a much more organized structure for the primary care, and this could be an integrated primary care structure as well. And hence, our primary care and public health systems started to develop. We now have we have clinics which are both fixed structures, they are made in containers, they are in the boat as well, and in mobile as well. And over a period of time, they've introduced public health issues like TB, the midwifery, they have added malaria, mental health, and all of these things are there. And we are now in nearly half of Pakistan. So out of 169 districts of Pakistan, Indus Health Hospital is present in 87 districts of Pakistan. And this is what the network is about, so that we can spread and change the ecosystem. Remember, every single patient that is being seen here is being seen free of cost. There is no cash counter in any of our centers anywhere in Pakistan. So it is not the strongest or the most intelligent which will survive, but those who adapt, and that's the adaptation we did. Can you just press enter? Just press enter. And we built a big hospital in Lahore, as our board had decided, large hospitals. And this is a 600-bedded hospital in Jubilee Town in Lahore, out of which 200 are currently functional, and the rest will start functioning very soon. And similarly, Indus feels that the service we are giving must be grouped together with education as well as with research. And hence, the Indus University of Health Sciences, we have the charter, the building is about to finish, inshallah, next year, and you'll be seeing students just like DUHS, IUHS students across the board in Karachi as well. Currently, we have four schools working for nursing, for physiotherapy, for medical technology, for public health, as well as for rehabilitation. And our impact across the country is we see 5 lakh patients every month, all of them absolutely free of cost. So the lesson is, when you plant a tree, you're not guaranteed that you are going to be able to sit under it, but that should not stop you from planting the tree. And this, can you play that, press enter, is the tree that we had posted. That small building at the right was the original building. Now a 1,300 bedded hospital, a state-of-the-art, is ready, functional, and we've moved into it, and we are slowly and gradually populating it as well. So this is what was the dream, which started off with just a hospital, has spread across Pakistan, has spread into a network. It has produced a whole ecosystem of health, which is providing care absolutely free of cost to everybody. And all it needs, a dream, is for somebody to believe in it. And these are the 4 people who believed in the dream and made this all happen. So my dear colleagues, if your niyat is right to serve Allah subhanahu wa ta'ala, there's nothing impossible in this world. Every Pakistani deserves good quality health, which should be available to them free of cost and in dignity. So this is what we have managed to do. This is the change that we have all been able to achieve. And in this doing so has certainly changed my life, has changed, I'm sure, many whose we've touched. So thank you very much.